So primarily what we see is that there is a large indication that lifestyle significantly impacts your health, but also your endocannabinoid system. And so there are instances where we've seen the endocannabinoid system has been measured in different styles, factors such as the diet of the individual, the nutrients that they're putting into their body, the amount of sleep that they're getting, all goes into the regulatory balance of your endocannabinoid system. And again, obviously your body as a whole trying to survive and maintain and flourish with poor nutrients and with poor sleep. Alcohol and drugs also have a negative impact on the endocannabinoid system, which we can measure. And some of the combinations of alcohol with cannabis and other drugs can exacerbate some of the adverse effects that are experienced or reported around cannabis consumption and use. And so diet, sleep, and overall general health and well-being and lifestyle have a massive impact on your endocannabinoid system, but also at a clinical level, if we're overlooking those factors and just trying to prescribe a patient cannabis products, or they're just trying to use cannabis products and not changing or looking at some of those other lifestyle factors, we're missing out on large pieces of the puzzle and not really getting a full picture of what's going on with that patient and how we can get them to the best possible health state. So as a bit of a summary, we've got a nice little overview slide here of the two fundamentals as we see them, which are cannabis and the human. Firstly, on the cannabis side, the crop itself is highly variable. Most cannabis plants and every cannabis interaction is more or less unique. There are unique combinations of compounds, ratios, of terpenes, and all of those have little unique changes and effects on the results that you experience either as a patient or on the symptoms that you're trying to target. As well as that, a lot of cannabis products at the moment are unregulated, although there are very clear and outlined now access pathways for cannabis products. A lot of the public still do source these quite irresponsibly, and as well as that, the market is very difficult to regulate at the moment, especially if we're talking about online products. So that's something that we need to be aware of, in that not all cannabis products are the same, highly variable. The content can be massively different from what's reported on the label.